My name is Lubna Ahmed. I am the Director of Environmental Health at We Act for Environmental Justice. We are a community-based nonprofit organization located right here in Harlem. And we have a staff of about 16 people, and we work hard to build healthy communities by ensuring that low-income individuals and people of color are involved in the meaningful creation of sound and fair environmental health protection policies and practices. Before we get started, and before I introduce Ms. Peggy Shepard, who is our Executive Director, Dr. Diana Hernandez, who is the Director of the Columbia Center for Environmental Health in Northern Manhattan, and Dr. Ricky Pereira, the Director of the Children's Center. I wanted to just run through the program briefly. All of you can find an agenda in your booklet. It's on the, as soon as you open the cover, you'll see the agenda there. And so we're gonna have our welcome speakers. We're gonna have Milagros, our Environmental Health Program Manager at We Act, speak. And then following that, we will have 4 guest speakers present. Each speaker will be speaking for 10 minutes. And you all will have an opportunity to ask questions directed towards the speakers for 5 minutes after each of their talks. And those questions are meant to be, burning questions that you have specifically for that speaker, or if you have anything that you want to clarify that they spoke about. And if you have kind of more broad questions, those can wait to the end. We have 35 minutes from the 7:10 to 7:45 block for question and answers. And if you all prefer, you can raise your hand if you prefer not to speak. We have folks walking around with note cards, so just raise your hand, ask for a note card, you can jot your question down and hand it back to the person that gave you the note card. And our 4 speakers will be up here as a panel, answering any of the more broad questions that you all have. And then we'll be closing the program out with our Deputy Director, Cecil Corbin-Mark, providing some closing remarks. Just as an FYI, the bathrooms are located up the stairs, past the registration desk on the left. And I think that is about it. And so we will get started. All right, so to start off, I would like to introduce our first speaker. I will not be doing thorough introductions because all of the speaker profiles are in your booklets. But it's my honor to welcome Ms. Peggy Shepard, our Executive Director and Co-Founder of We Act for Environmental Justice, to the stage. Thank you.
So, good evening, everyone.
Good evening.
This is a convening I really wanted to have for many, many years. So I'm really happy to see all of you here tonight, including some of We Act's members and our allies. Again, I'm Peggy Shepard, co-founder, executive director of We Act. We're celebrating our 30th year of trying to achieve environmental justice here. Many of you all know we started with the North River Sewage Treatment Plan and working on the bus issue because of poor air quality. And we've been working on a range of issues, whether it's the West Harlem Pierce Park or air quality and climate change. And we're hosting this community briefing with our long-term research partners, whom you'll meet in the next few minutes. But now, many of you know that We Act started organizing in this community to really address the disparate environmental exposure to a whole variety of toxins in our air and in our homes. And it's this disparate exposure that's a burden to many communities of color and low income, not only in this nation, but also abroad. We know that pollution and toxins impact community health. And they impact communities like Harlem. And as a result, we're exposed more frequently to multiple environmental and social risk factors that together contribute to poor health outcomes, rising health disparities, and health inequity. And so that's why we have helped to develop and build the capacity of a national movement focused on achieving environmental justice and health equity. Now, this meeting has been a long time coming because effective and successful advocacy and evidence-driven campaigns must be aligned with public health concerns, data, research, community awareness, community mobilization, and very, very important, the political will to create change. So creating a culture of health, it's not just about personal behaviors and access to health care, but it's also about systemic and broader societal factors that may shape health inequities. Think cigarette and alcohol advertising, which leads us to understand that the marketing and use of beauty products is a factor that may shape health inequities in women's reproductive health across the life course. We know that multicultural beauty products have outpaced the overall $400 billion global beauty product industry. African American consumers purchase 9 times more ethnic hair and beauty products than other groups, and disproportionately purchase hair relaxers and straighteners. Latinos are also the fastest growing ethnic beauty market segment, and Asian Americans spend 70% more than the national average on skincare products. So as a result, these women and their offspring may experience heightened vulnerability to these chemicals, especially if products are used during what we call windows of susceptibility, such as preconception, pregnancy, early childhood development, and adolescence. So we're really challenged to achieving health equity when we have targeted racial ethnic marketing that highlights mainstream beauty norms and distributes images that idealize whiteness. Those images do influence use of hair straighteners, skin lighteners, and odor control products. And as one of tonight's speakers, Dr. Amy Zota, has written, beauty product use may be one way that structural discrimination becomes biologically embedded. So this is one of the key challenges to achieving health equity. So now to give you a more deep understanding of some of these issues from a research and academic perspective, I'm going to introduce you to our 2 research partners. The first will be Dr. Diana Hernandez, who's the Assistant Professor of Socio-Medical Sciences at the Columbia Mailman School of Public Health, and she's the Director of the Community Outreach and Engagement Corps. And WEACT works with that core as well as the Children's Environmental Health Center to translate research into policy that impacts our health. So let's welcome Dr. Diana Hernandez.
So I promise to be really brief in my remarks. Welcome, good evening, bienvenidos. Hello, you look so familiar. I'm really here, and not to be an expert. In fact, the experts will do their thing. And in preparation for today, I thought about my own product use. Before I left my home today, I used at least 12 products. The shampoo, the soaps, the conditioners, the hair products that I use, the makeup that I wear on my face. And as someone who is environmentally conscious and someone who cares about my own health and the health of my community, I'm really honored to be here more as a spectator, but really also as someone who's highlighting the great work of the speakers tonight. They're going to be walking us through this issue from a life course perspective. So thinking about women and girls and justice, and not only the problem, but what can be done. And really the hope for today is that we can realize our beauty, as the kind of hashtag for today's discussion is beauty from the inside out, that we would actually honor ourselves and our beauty from the inside out. And we're really honored to have the panelists today. I'm going to turn over my time to Dr. Ricky Pereira, who is the director of the Children's Center for Environmental Health at Columbia.
Thank you very much.
Thank you
very much, Diana. I'm armed because I've had a little cough, so not contagious, but this is just in case. So I'm so happy to be here. This is such an important issue. It does affect us all, and it affects our children. So 20 years ago, so we're 20 years old, you're 30 years old. I think I look a little older than that, but this Columbia Center for Children's Environmental Health was founded in 1998. At that time, we thought that the placenta was a pretty perfect barrier protecting children from the time they were conceived. And we didn't know enough about the exposures that could get across the placenta from the mother's breathing in or using products on skin or from her diet into the baby before birth. And we didn't know enough, very much at all, about what were the exposures that children were encountering as they grew up through their diet, through the air they breathe, through everyday products in use in the home, and getting under the skin of children and causing harm to their health and development. So we set out to do some studies to learn about that, and our method was to enroll a large group, 720 pregnant mothers, and follow them and their children for many years, evaluating their exposures, their health, their development. And when we found harmful exposures, we would inform the parents, the families, the community, and publish our findings so that the broader public would know about this work and the findings. And from the very beginning, we partnered with REACT because they were the perfect partners to help us to get the information that we were gathering out to the communities and public and policymakers. So this has been a long-term partnership. And our findings are that many chemicals are making their way into the bodies of children, and that there are many things excuse me, that we can do to protect children. And one of the things we've done at the center is to work with REACT and come up with various tip sheets on how to avoid toxic chemical exposures. And we have one out on the table exactly on this issue of toxic shopping and personal care products. So please take some of these. They're on various aspects of diet and consumption of products. So I hope they're helpful. And that work has been done jointly with REACT, called Healthy Home, Healthy Child campaign, started in 1998. And Kim Burke, is she here? Dave Evans, who is here, have headed that work, headed up the community outreach translation core of our center, and Diana Hernandez has joined up, and so we're it's a very strong group. So one of the findings from our work and from others is that many of the chemicals in personal care products are able to act like hormones or block their normal action. And they're called endocrine disrupting chemicals. And so you're going to hear in a moment from Miranda Spratton. Miranda, where are you? There you are. About her work at the Columbia Center for Children's Environmental Health, where she has been looking at measuring the exposures to 3 types of chemicals in personal care products: phthalates, parabens, and phenols. In everyday products, as Diana said, she used 12 products. I probably used as many this morning as well. And she'll also talk about ways to reduce exposure. Because there are things we can do in our own lives, also things we can do in our shopping, and shifting markets to safer products is one of the goals we all have. And then, of course, there's the policy making. So we do need regulations on products as well. And hopefully, not just hopefully, we've already seen it, the combination of science, such as what we're doing at the Children's Environmental Health Center, and the advocacy and expert work that REACT is doing on getting the message out and forcing change that way is a powerful tool to protect our children. from the time they're conceived to the time they themselves are adolescents and using 12 different products every day. So thank you so much, and pleasure to be here tonight. Are there any questions about the work? Or you can learn more on our website, ccceh.org. And we now have 3 different cohorts running here in New York City. So our oldest children are 21, which is quite impressive. We've been following them since their time their mothers were pregnant, and our youngest children are just being born now. So stay tuned.
Okay, thank you, Peggy, Dr. Hernandez, and Dr. Pereira for highlighting the history of our partnership and talking a little bit about the work that each of our organizations does. So our next speaker is Milagros Deos. She is the Environmental Health Programs Manager at We Act for Environmental Justice. And for those of us who are a little bit less familiar with this topic, with just like a broad overview, understand how this topic relates to our community in particular, this next talk is for you. And Milagros will also be touching on what can we do with this information? What are the action steps that we can take with this knowledge, and how can we apply it to our daily lives? All right, thank you.
Good afternoon, everybody. Can you hear me? Yes. Okay, so as Lubna mentioned, I'm Milagros Deos. I'm Riad's Environmental Health Programs Manager. And I just wanted to make sure that we are all understanding like why we chose this topic, why we're talking about it here in Harlem, and how this is actually impacting our community's health. We have some information here right in the middle of your booklet on how these chemicals get into your body. So if at any point there's something that you don't understand, you can refer to this page that has key terms. And you can also ask questions from the experts that are going to be talking after me. But before they talk, I have my 10 minutes, and I wanted to share a little story with you guys. I came to the US 5 years ago from Buenos Aires, Argentina, and all that the airline allowed me to take was like 2 suitcases. So I really put everything that I thought was essential in there. That was my clothing, some books, some like sentimental items, and I didn't bring any beauty products or personal care products with me. First, because I never wore a lot of makeup, and also because all the makeup that we really had in our home was shared by my 2 sisters and my mom, so they wouldn't have been happy if I took everything with me. So I got here in April, and I got invited to a wedding in June. So I was like super happy about it, super pumped. So I went to the mall, and I went to buy a dress. And after I got my dress, I was happy, and I was thinking, okay, what else do I need? And I see Sephora. I'm like, okay, that's what I need. I need some makeup to feel great. You know, I'm gonna be meeting a lot of new people. I'm an immigrant, so I wanna look my best. So I go to Sephora, very shy, very timid. And this like sales rep shows up out of nowhere. She's like, do you need help? I'm like, of course I need help, please help me. I explained to her that I'm going to a wedding, I don't really wear any makeup, and she says, okay, I'm just gonna give you the essentials. So you can imagine, Sephora, like 30 minutes later, like $150 less in my pocket. I leave with a bag like full of essentials that I still have sitting on the counter after 5 years. So you don't need to show hands, but I can imagine, I see some people nodding that you can relate to that, right? So this is just to really think that I thought was essential and that I wanted to do is not really essential for me because it's sitting on my bathroom. And when I came to We Act, doing a lot of work and working with a lot of experts, I really came to understand that all these products that are supposed to make us look great, make us feel wonderful, can really harm our health. So that is what we are trying to like show you today with a lot of like experts in the room is like how really beauty products are one way that harmful substances can get into your body and really affect your health and add to the health disparities that Peggy was talking about. As we work together, she mentioned some of the things that I also wanted to share with you guys today. That is it, why are we talking about this in Harlem with our members and our partners and our community? And this is because we know that us here in the room, our mothers, our grandmothers, our children, those are those who are most impacted by this problem. As Peggy mentioned, African American women purchase 9 times more ethnic hair. The Latino community is buying a lot more products, and the Asian American is also buying a lot of products. It's not only that the consumer says, but we also know that workers in this industry are usually women of color, immigrant, who are not just like experiencing that one time, as when you put that hairspray on your hair, but they're probably doing that like 5-6 times a day, right? So they're being like disproportionately impacted because of the job that they have. And this, on top of it, something that's supposed to make us like feel great, is only piling up on top of a lot of other ways that we expose ourselves and our family, and that we know that our communities are disproportionately impacted by that. So the neighborhoods where we live usually have a lot of traffic. They may have a marine transfer station, they may have a bus depot, they may have not the greatest like food options that you can find, maybe not really nice parks where you want to go and like do some jogging. So it's really like something that is piling up on top of many other environmental injustices that we live day in and day out. So this is just to really clarify, how are beauty products related to environmental justice? This was really explained when the principles of environmental justice were written in 1991. People got together in DC and they wrote 17 principles of environmental justice that I definitely encourage you to go and like look for them. And I just found 2 that really relate to what we're dealing with it tonight. The principle number 6 talks about that environmental justice demands the cessation of the production of all toxins and hazardous waste and radioactive materials, and that all past and current producers be held strictly accountable to the people for detoxification and the containment at the point of production. So here we can think of like different toxics, hazardous waste. They're not radioactive materials, but you're gonna find out that there are like some pretty nasty stuff in the products that we use. So producers need to be held accountable, and we need to like tell them loud and clear that we don't want those things in our bodies. And the people that also produce them, work in the facilities, are also getting sick. Another principle of environmental justice that really relates to this issue is the affirmation of the right of all workers to a safe and healthy work environment without being forced to choose between an unsafe livelihood and unemployment. And it also affirms the right of those who work at home to be free from environmental hazards. So again, thinking about the workers, thinking about those most impacted by this issue, this is something that was written in 1991 that is the foundation of what we do at WEAC. And is very relevant to this topic here. So the problem is really big, but I think that the opportunity is really bigger. So what can we do? These are some things, and this is not a full list of things that we can do to change this. But the first things that we can do is like, take this with you. And if there's some extra, give it to someone else that you know. Look at what are the chemicals that should you be avoiding. And they're very complex names. I cannot pronounce them, words in English. But you can take it with you or take a screenshot and try to remember some of them, right? You can also demand that manufacturers list the ingredients on their products. And this is something that our deputy director is going to be talking about later, right? Sometimes you buy something and the label doesn't really say anything. Or it may say fragrance. Okay, what's inside that word? What does it mean for my health? Something else that we can demand is that manufacturers change their formulas and stop putting harmful chemicals in products. Why are there two different talcs, for example, baby powders, one that has talc and one that doesn't have talc? If we know that something is wrong, let's take it out of the shelves completely, right? Let's not leave it up to the consumer to see whether they want to buy something with talc that's going to harm them or not. You can also join WEA and other organizations in demanding that the government passes and enforces, because there are a lot of regulations out there that aren't being enforced, to take toxic chemicals out of products. You can use the hashtag #BeautyInsideOut, tweet to your representative, go to public hearings, and join WEA. You can also have open conversations with the people that provide these services, your hairdresser and other professionals, people who work in the nail salon that you go to really start having this conversation and really understanding that they are being the ones really, really impacted by it. So how you can work together to make sure that you're both getting what you want and what you need, and no one is being harmed in the meantime. When there's natural options, opt for them. We have a lot of materials also that teach you how to make your own products, right? So choose that. And also really ask yourself, like I'm doing now, looking at that Sephora bag. Do I really need this product? Is this really gonna give me what I think it will give me? Just something to think about. Thank you.
All right, thank you, Milagros. And thank you for sharing the story of your first terrifying journey to Sephora. Okay, so I just want to remind speakers that you will have 10 minutes to speak. I will be keeping time, so if you could just occasionally glance over to make sure that you're keeping with time. And then at the 10-minute mark, we will open it up to the audience just for about 5 minutes, again, to ask any burning questions that are specific to the speaker. And we'll have a larger Q&A session towards the end of the program. Our next speaker is a assistant professor at the George Washington School of Public Health. Dr. Ami Zota's title of Dr. Ami Zota's presentation is The Environmental Injustice of Beauty, Underestimating the Links Between Beauty Products and Health Among Women of Color. If you would join me in welcoming Dr. Ami Zota.
Good evening, and thank you for the invitation to be here. So I'm a public health researcher, and I do a lot of research in this area, and I also like to go around and talk to many different audiences about this issue, because I think some of the structural issues around our beauty norms can only be changed through conversation. So I was asked, kind of as part of my role, to frame some of the big picture issues around the science and policy of personal care products and chemicals. In addition to working on beauty products and personal care products, I work on consumer products more generally. And I think it's hard sometimes for people to grasp that there's an invisible chemical environment that surrounds us, in part because there are chemicals used in many of our everyday products that migrate out of these products into our bodies. So that includes personal care products, so cosmetics, soaps, lotions, sunscreens, as well as food and food packaging, another area that I work a lot on, the home environment. People are often surprised, but our paints, our furnishings, our vinyl, floors, we spend so much time there. All of these can be sources of chemicals that can migrate into our bodies and affect our health. And there are an enormous number of unregulated chemicals in our products and in our bodies. So we did this study using federal CDC data where they measure a whole big range of chemicals in everyday people's blood and urine. And we focused on pregnant women because, as many others before me had talked about, pregnancy and early childhood is a particularly vulnerable period of development. And it may be one period where we may be particularly vulnerable to the effects of chemicals. And we found at least 43 chemicals detected in virtually every U.S. pregnant woman. And so I think, sometimes it's hard to just grasp the basics. Beauty products contain multiple chemicals that can harm health. It's amazing to me that words like phthalates and parabens have become household names, but that's really just the tip of the iceberg. Lead, the thing that you think is a problem in old housing, we're still finding it in hair dyes, in kids' makeup, mercury in skin whiteners, triclosan, benzophenone 3, formaldehyde, human carcinogen. These are all chemicals that have been found in contemporary consumer products. And there are a lot of potential health effects that can be associated with these chemicals, including endocrine disruption, cancer, reproductive harm, asthma and allergy. Allergies to fragrances more generally are increasing, as well as neurodevelopmental harm in children exposed early in life. So you may ask, why do we have this problem? And I think whenever we talk about this, we have to talk about our policies. Most of us are under the assumption that if we can buy something on a shelf in a store or on Amazon, that it has been screened for health and safety concerns. But the reality is that the federal laws, so this falls under the jurisdiction of the U.S. FDA, and the law governing how we evaluate personal care products for health and safety concerns, this law was written in the 1950s. And it's only 2 pages long, and it hasn't been substantially updated since then. So the main law that's governing the health and safety of our personal care products is outdated and ineffective. Under this current law, FDA lacks the authority to review ingredients in personal care products to determine whether they are safe. Consequently, in the United States, only 11 substances are banned or restricted from use in these products, compared to Europe, where it's several hundreds of substances are banned. And we're basically relying on U.S. companies that market and make these products to determine their own health and safety standards. And partly, so you can imagine there's a lot of problems, including the fact that companies do not have to disclose all the ingredients in their products. And until we fix this core problem, so much of the burden on determining how safer or what products to use is falling on individual families. So now I'm going to talk a little bit about one particular class of chemical that I know I study as well as other researchers study. This is phthalates. So the P in phthalates is silent, and these are man-made chemicals used in hundreds of everyday products. They've been shown to disrupt hormone signaling systems. There's strong evidence of reproductive harm in both male and female animals. And in human studies, like the kind that Dr. Pereira's group conducts, phthalates have been associated with infertility problems, preterm birth, and other pregnancy complications, as well as increased feminization in male offspring. And right now, they're actively being researched in the context of obesity and type 2 diabetes and chronic diseases, because researchers think they may play a role in those conditions as well. So phthalates can enter phthalates and other chemicals in personal care products can enter our bodies through multiple ways. One, even when you're using nail polish or something, they can actually off-gas into the air and you can breathe them in. When you put them on your hands and then you touch food, you can end up ingesting it. And then they can also be absorbed directly through our skin. So my work has shown, because we can measure the byproducts of phthalates in our bodies, so we commonly use urine samples, and we have found that black women have significantly higher levels to two phthalates commonly used in beauty products compared to other women. So we began asking what may be driving this. And we thought personal care products may be part of the story. So we actually started looking at the feminine care industry and feminine care product use, and found that use of vaginal douches was in part contributing to these higher levels of phthalates in black women compared to other women. Other colleagues have further demonstrated that hair products commonly marketed to black women and children have elevated levels of certain endocrine disruptors, particularly phthalates and parabens. And I think another speaker later today is going to talk about the elevated levels of mercury in certain women of color in New York City tied to skin lightening creams. But all of these studies really focus on individual behavior. And I find that problematic because we know that beauty rituals do not develop in a vacuum, and that there's a big impact from structural racism and the cycle of socialization. And so I've begun writing about the issue to reframe it in a social equity context and in a health disparities context, because I think whenever we talk about these issues, it's important to recognize that globally there is a hierarchy of racially coded degrees of beauty, and the hierarchy posits that whiteness and white femininity is the norm for most women and men to strive towards, and that these beauty norms and ideals are reinforced and magnified through multiple routes, including policies and dress codes. And some of this was on social media recently. The young boy who had to cut off his dreadlocks, the wrestling coach who made him cut off his dreadlocks before he could play, right? I mean, that was a school policy, or maybe it wasn't a policy, but right, that is going to possibly influence how he wears his hair in the future. There's targeted advertising, there's cultural norms, and there's peer pressure. And all of this results in internalized racism, which has a profound effect on our everyday beauty rituals. And this is tied to some of the statistics that we talked about earlier about multicultural beauty products outpacing the overall cosmetics market. And this is just an example of this, the type of marketing that we're influenced by. This was a Dove commercial in 2017. This is 2017, right? Before and after. And it didn't have a long life because they had such social media backlash. But this is a current contemporary issue globally. And so my work in part posits that one driver of adverse health outcomes, particularly among women of color, are these racialized beauty norms, which in part are driven by these toxic beauty product chemicals. And so here are just some examples. And this is also in your booklet in the table. So, we have some examples here of different kinds of products, as well as not only the health effects and the chemicals, but the racialized beauty norms that are driving the product use. So if we think about skin lightening, one big factor is colorism, a global phenomenon that really gives preference to lighter skin. I know that was a big influence in the South Asian communities that I grew up in. Or hair texture preferences that then drive greater use of hair straighteners. And there's also cultural norms about odor that particularly among, there's a lot of racial stereotypes, racist stereotypes about odor that have driven greater use of feminine care products. And so this includes vaginal douches and, also talc powder, feminine talc powder. And, this has gotten a lot of attention with the Johnson & Johnson lawsuits. So I just want to wrap up to reinforce some of the things that Milagros talked about, that it's not just this issue in a vacuum. The same women that are exposed to more hazardous chemicals from their beauty products often live in polluted neighborhoods
and often encounter hazardous chemicals in the work environment. And the last thing, because I always like to end on a hopeful note, it is that policy interventions can make a difference. So this is a paper that we published a few years ago now, and we looked at trends in phthalate exposures in thousands of Americans over a 10-year period. And what we found were those phthalates that were banned in children's products went down over that 10-year period. Those products that were targeted in marketing campaigns from NGO advocacy groups, including WEAC, those also went down in people's bodies. However, unfortunately, we did see the rise of replacement chemicals, and you know that brings up some other policy issues. But that's just to say that we can improve this problem. We can change it. So with that, I'll just say thank you.
Here's a question. All right, yes, well, we're going to open it up just for 5 minutes for the audience to ask any questions to Dr. Zota. I just want to make a quick announcement. If you have an open chair next to you that you have your coat on, there are a couple folks that are waiting to be seated, so if you can just make a little bit of room. Yes.
Yes, you mentioned that these products mess with the hormones, the chemicals, and I'd like to know, does it also affect a woman's menstrual cycle, and also this condition that many aren't aware of called PCOS, polycystic ovarian syndrome? Do these products have some play into that?
Yeah, that's a great question. So one of my research areas, which I didn't get to talk about, is that I'm studying a lot of these chemicals in the context of fibroids, uterine fibroids. So that's another condition, right? It's estrogen and progesterone mediated. Not that PCOS, endometriosis, so many women are suffering from them. Very hard to study and understudied in the research community. So I would say that research is not as, it's just not as sophisticated as some of the other research. But there is some data to suggest that they could be playing a role in some of these gynecological, women's health, reproductive issues. But yes, I'm thinking a lot about the fibroids these days. Thank you.
Other questions?
Yes.
Good evening, Dr. Zota. I have a question. I may not be the only one with this question, but I'm getting some gray hair, and I wanted to know what are the alternatives to chemical. Currently I don't use any, so don't judge.
Yeah, that's a great question, because I think just ageism is a big factor. And one good thing, the NGOs just sued FDA and successfully got lead out of hair dyes finally. So maybe your hair dyes will be a little bit safer. But one thing that I know that my mom uses, she uses henna actually, and it does, it's more of a natural product that can cover up the gray and make it auburn. Yeah. But there may be other DIY type techniques out there as well.
Any other questions?
One more question.
One more?
Oh, right over there.
Oh, I'm sorry, ma'am. I apologize.
You talked a lot about the feminine care products and things like that, but what about just regular lotions and petroleum jellies that we also use a lot of in our communities? Are those toxic as well?
Okay, so all of these have a lot of a lot of chemicals, and so the way sometimes these studies are done, it's like they link the products to the chemicals in the body, and then they link the chemicals in the body to health effects. So I will say that lotion, because how long it sits on your skin, does end up being often a source of these chemicals in your body, because how long it sits on your skin. And then with petroleum jelly, I do know of one study that actually looked at certain hair and skin products and looked at the total hormonal behavior of those products. And petroleum jelly was actually one of the most estrogenic of the products they tested, and I don't think that they were expecting that. So I don't know, how that affects health long term. I don't think it's really been answered, but that's what I do know of the literature. So some of this is kind of trying to put puzzle pieces together.
I just wondered if you could define endocrine disruptors and estrogenic for those who may not know what those are.
Sure, yeah. So, so the simplest definition of endocrine disruption is a substance that can interfere with how hormones behave in your body. So it can either act like that hormone, like it can act like an estrogen, or it could block the activity or signaling of estrogen. So so if it would act like an estrogen, we'd call that estrogenic, and if it blocked the estrogen, it would be anti-estrogenic. So one reason we got so concerned about the phthalates was because they're anti-androgenic, so they actually blocked some of the activity of testosterone. And so that's why, especially around the fetal health kind of conditions, you sometimes see stronger effects in the male babies than you do the female babies. Does that kind of answer the question?
What do you mean that's
Oh, well, hormones play a huge role in everything, right? And just it plays a big role in how your brain develops. It plays a big role in your reproductive health. So it plays a big role in many everyday kind of functions, I would say.
Great, thank you so much, Dr. Zota. And thank you for talking about chemicals and beauty products and how they disproportionately affect women of color, and specifically talking about phthalates, their routes of exposure, where they can be found, and how we can avoid them. Our next speaker is Dr. Jasmine McDonald. She is the Assistant Professor of Epidemiology at the Columbia Mailman School of Public Health. The title of her talk is Hair Product Use and the Age at Menarche. So she'll be speaking a little bit more, I've already heard interest in the room, about chemicals and how they affect women's health, especially as they reach reproductive age. All right, thank you.
Thank you so much for everyone who's here this evening. As she said, I'm Jasmine McDonald. I want to thank WEACT as well as the Children's Center at Columbia for inviting me to speak here. So I'm really going to talk about what Diana was saying, a life course perspective. So when we think about exposures, how I operate in my research, and my research is primarily breast cancer prevention, I ask myself if the exposure occurs at a period of time where the breast tissue or the reproductive system may be more vulnerable. And so let's start with just asking a broader question. Does hair product use in early life, such as in childhood, interfere with women's health? Well, first of all, what are hair care products? In general, they're vast, a variety of categories, everything from hair oils, hair lotions, root stimulators, leave-in conditioners, washout conditioners, co-wash conditioners, perms and relaxers, hair dyes, etc., etc., etc. But though the categories are varied, there is a universal use of these hair products, which is you apply it to your hair or your scalp and they get absorbed into the skin. And so we've heard a lot about what an endocrine disruptor is, but in general, an endocrine disrupting chemical can create hormonal activity. And that hormonal activity can actually interfere with your own hormone production. And your own hormone production signals very important reproductive signals to say, like, go through menarche, start developing breasts, have a baby. There's a lot of variety. It also interact with your immune system. For example, when you're pregnant, hormones are able to mediate your immune system so that you don't reject the fetus. So hormones are integrally involved in everything that we do. But if you have this interference with a endocrine disrupting chemical or an EDC, that could also lead to hormone related issues. And so the idea is that these hair care products actually have additives that are EDCs. And these are to enhance the hair care product. So for example, you have synthetic estrogen. So this is, not your own estrogen, but a molecule that mimics estrogen that's added directly to a hair product. And often that's added, and they say this product promotes hair growth. There's phthalates that are added so that the hair product smells pleasant. And then there's also parabens added for long-term shelf life. But in general, these hair care products have EDCs that have hormonal activity and may impact women's health. So we've already stated this before, but it is no surprise that women and minority women in particular are dominant consumers of these healthcare products, these hair care products. Now, the hair care products that they're using, typically, majority of literature says the majority of them do have harmful chemicals such as EDCs. Not only that, minority women such as Black women are the highest consumers. There was a study done that said 94% of women had used a perm or a relaxer before the age of 45. I'm part of that statistic, but this is it's part of my hair journey. The idea of these chemicals is that, so we know that these products are predominantly or avidly used by minority populations, but on the flip side, we know that there's disparities in health that are related to minority populations. Black women are likely to have higher rates of infertility, uterine fibroids, endometrial cancer, breast cancer, and early age at menarche. Now, as an epidemiologist, I'm not saying that these products cause uterine fibroids or these products cause cancer, but the observation is strong that there's a high use of these products in our community and there's a high disparity of these diseases. So something that my research group did was to ask women in a cohort, so a group of women, two different groups of women that were New York City based and a multi-ethnic cohort. We asked them at the age of 47 to recall their childhood use of hair products. So their use of hair oil, their use of hair lotions, what was their hair journey in childhood. We also asked them to recall their age at starting their period, also known as menarche. And what we determined as a cutoff was saying that if a woman reported that she started her period before the age of 11, that would be an earlier age at puberty, meaning it's earlier than the average that you see in the population. And so we asked, is hair product exposure in childhood impacting a girl's pubertal development? And the answer is yes. We found an association, which means that we saw that women who reported hair product use, especially hair oils, had an earlier age at puberty. And then imagine hair oils often go directly on the scalp. Now, this was of concern, but then you may ask yourself, well, so what? The girl has an earlier age at puberty, she gets her period earlier, what does it matter? Well, it actually has very big implications for breast cancer risk. So there are a number of risk factors for breast cancer, but one of these well-known, well-studied, established risk factors is age at menarche, or the age that a girl starts her period. And the earlier age a girl starts her period, the higher the risk of her developing breast cancer in later life. So indirectly, if we see that childhood hair product use is associated with an earlier age at Menarche, you have now changed that child's trajectory for her breast cancer risk in later life. Now, there was a song that came out in 2006 by India Ari, I Am Not My Hair. I'm not playing that for you right now, but if you go back, it's very nostalgic to see that video. But what she focuses on is that, you know, she went through a hair journey, and one of the things she states in her song is, this is her reflection. Little girl with a pressing curl, age 8, I got a Jerry curl. 13, and I got a relaxer. I was a source of so much laughter. At 15, when it broke all off, 18, and went all natural. And that's a lot in a childhood to go through for your hair. And Diana mentioned putting 12 products on her body before she left. I mean, maintaining a Jerry curl, people may be too young to know, but it took a lot of products. So that's just one period of her time before she even turned 13. So the chemicals that are in these products are potentially harmful. We cannot say it causes these end diseases like breast cancer or endometrial cancer, but we can say that it may have an effect on risk factors that are associated with these outcomes. And so when I think about this, I say be cognizant of the products that you use on your own body, but especially in childhood, because puberty is a very vulnerable window where the body's constantly growing and developing and changes, and there's a high cell turnover in your body. And that actually leads for more opportunity for things like cancer. So, educate yourself. You have these booklets. It gives you some key terms, but when it comes to hair care products, there's now this movement for embracing the natural texture of your hair and not changing that. But whatever you choose, whether it's natural, whether it's straightening, or whatever you choose, be knowledgeable. You want to see things that say phthalate-free, paraben-free. You want to make sure it doesn't have any synthetic estrogens. And a lot of ingredients aren't listed. So if it says parfum or perfume, no, that's a phthalate. That's likely a phthalate that's been added so the product can smell nice. Also, when the ingredients are listed, be knowledgeable that they're listed in the order of the percentage that's in the product. So the first product listed is the highest concentration that makes up that product. So if you're getting a product that you believe that is perfect for your hair, just try to make sure if you are going to go the route of having some type of synthetic chemicals, it's not the first, it's not in the top list. But in general, you want to go with organic products. Educate yourself, be selective, be discerning. And I know we've focused on females, but we all know that our young boys are also putting these products in their hair. They're using their sister's products, their mother's products, whatever's around. So we can't forget that there's also disparities in health outcomes when it comes to our minority males. So also be careful of the products you apply on their hair as well. Thank you.
What about with chemical
Okay, hold on.
relaxer?
Let me get the mic too.
Thank you.
Thank you.
What about with the chemical relaxer, when there's a chemical burn, what extent is there maybe some kind of effect of hormonal damage?
So there has been a study done on relaxers, but you can think of the chemical burn as a dose of your exposure, right? So that means that that chemical has been on your hair long enough to actually cause a physical damage. Not just the burning, but a physical damage. So you should think of that as like an extreme dose of exposure. Usually when they do studies, they'll ask questions like, have you ever gotten a perm or relaxer? And some studies have suggested that there is a modest increased risk of breast cancer due to the the endocrine disrupting chemicals that are in a relaxer, but it hasn't been consistently shown. But that's also because we're talking about dose. Now you ask an important question, if it burns, well, maybe a question should be, have you ever been burned by a perm relaxer? But another thing is how often somebody perms or relaxes their hair. So even though we can't say statistically significant that perm and relaxers are associated with breast cancer, the fact is that it's of concern enough that it should be not used or used at a very low rate.
My question is, are there any studies for women in menopause and perimenopausal period?
So that's a very vulnerable period also in a woman's development, and we specifically asked the question of these women. Most of them are post-menarcheal, okay, so most of them are premenarcheal, not pubertal, but premenarcheal because they're about 47. But a number of them are also in perimenopause and going over to postmenopause. This is a really hard area to study when you're talking about the transition period, and that's the period of vulnerability, the transition. So we also looked at adult use of hair care products as it relates to mammographic breast density, and that's a term that's used as another risk factor for breast cancer. So the denser your breast. So for women who are getting mammograms, you'll get a report that says you have dense breasts. It's New York law. Please see your physician for follow-up care. And that's because higher breast density is associated with breast cancer. Now, we did not see an association with using hair care products in early life, nor using hair care products in adulthood as it relates to breast density. But the caveat is that perimenopause is a very hard thing to define in research. So that doesn't mean that an association doesn't exist. Also, you have to realize, we said 12 products being applied. I'm just talking about hair. There's other products that people are applying. So your exposome, your entire exposure may be greater when it comes to phthalates, parabens. I'm just talking about a select product right now.
I just wanted to take a quick second to acknowledge the arrival and presence of Assemblywoman Carmen de la Rosa. And she represents the Northern Manhattan District, and thank you, Carmen, for being here. We know she's passionate about a lot of these things, so we're expecting good things of her. Thank you.
Thank you for your presentation. I do have a question. As more of us are becoming aware of the hazards of the chemicals within these hair products, and we're shifting from products that we may have used when we were little to perhaps now using more castor oil or shea butter, has there been any comparative studies between, well, now we know the products, but now these other products or chemicals that people are not using?
Yeah, so that's an excellent question, because I've actually seen, like, you see, like, oh, this is natural coconut oil, and then when you read the back, it has all the synthetic materials and coconut oil, or it says this is shea butter, and then you read it and it has all of these other chemicals. So the manufacturers are very savvy. They know that we're moving in that direction. There has not been a comparison study per se to say, like, is the use of shea butter better than the use of castor oil. But I would say today's products are very different than yesterday's products. So even if it says shea butter, unless it's completely 100% shea butter, you would have to just make sure of that to make sure no synthetic chemicals have been added. And then also the comment about the Vaseline or the petroleum jelly that has hormonal activity, that was measured in a lab. So I actually don't know of studies that have looked at the hormonal activity of shea butter or castor oil. But I do know traditionally those were used to promote hair growth and moisture, which has a tendency to sometimes have more hormonal activity. But I do not know the hormonal activity of those products.
This is the last question.
Hello. I have two questions. Is other than shea butter, what other brands do you recommend to use?
My sister told me everyone's gonna ask me that question, so I personally cannot endorse or say don't use a product, but I will also say, as a Black woman who has used so many products because someone told me to use it, didn't mean it worked on my hair. So it is a hair journey for a reason. You're gonna have to take this booklet where they give you all the names of things that you're avoiding, use Google, and actually like test out some products that work for your hair. And I say that because Black hair is so diverse. Minority hair in general is just so diverse that even if I gave you a product, that wouldn't mean to be the product that worked for you. So really it's your personal choice because it's your personal care product. Just be knowledgeable.
My second question is, when you were in your teen years, have you ever had to like cut your hair because of a product?
Say it again?
When you were in your teen years, have you ever had to cut your hair because of the harmful
Yes, I did a
product?
big chop. I did. That was part of my hair journey. I didn't have a jerry curl, but I did have a relaxer, and I definitely had to do the big chop. It was cool. Cat spit. Thank you.
Thank you, Dr. McDonald. That was a very informative talk, and I just want to remind everyone, we have a half an hour towards the end where folks can ask a few more questions to all of the guest speakers. Our next speaker is Dr. Miranda Spratlin. She, she is a postdoctoral research scientist at Columbia. And the title of her talk is Exposure ×2. So she'll be talking about the use and safety of personal care products during pregnancy. All right, Dr. Spratlin.
Thank you so much for having me, and thank you for being here. So as I mentioned, I'm going to be talking about exposure to chemicals in personal care products during pregnancy, but also beyond, and hopefully providing some useful tips on how you can use these products more safely and in turn reduce your exposure to the chemicals that you find in them.
Mic, please.
Is that better?
Yeah.
Okay. So first I just want to introduce you to the chemicals I'll be going over, and these have been fortunately mentioned before me, so hopefully they're becoming a little more well known to you today. I'm going to be focusing on endocrine disruptors, and we have to start phthalates, which of course have been talked about quite a bit, and these are found in fragrances. So really any product that says it has a fragrance added to it, you're likely getting some phthalates. These are in anything from deodorants to shampoos, conditioners, body lotions. And then with parabens, these are added to personal care products as preservatives and antimicrobials. And you'll often see them listed on labels as methyl, ethyl, butyl, or propyl parabens. So you can look out for that on the labels. And then lastly, we have phenols. And often we see them as BP3, which is in sunscreens, triclosan, which is an antibacterial and seen in some toothpaste. Actually, I'll be bringing that up later in the presentation, so just keep triclosan in your mind. And then finally, DCPs or dichlorophenols, and these are more in toilet and room deodorizers and mouthballs as opposed to personal care products. So when we think of these personal care products, as has been discussed, we think of really widespread exposures because most of us use at least one personal care product on a daily basis. And this is reflected in findings from national surveys where you can see here that at least 70, these chemicals are detected in at least 75% of women, and with chemicals like phthalates, as has been mentioned, and BP3, it's almost 100%. So it's a really relevant exposure to everyone. So we know that these chemicals are in us, and we know that they're in the products themselves, but does using these chemicals actually cause noticeable increases in the concentration of these chemicals in our body? Unfortunately, it does appear to be the case. So an example I'm showing here is from a study where investigators estimated how much of a common phthalate found in scented products a woman would have if she used perfume versus if she didn't use perfume. And you can see on the left here that that level is almost 3 times as high as a woman that didn't use perfume. So the exposure can be quite dramatic. And not only do we see associations between a specific product and these concentrations of chemicals, but how much of the product we're using. So an example here is from a study where they estimated actually percentage of the body that you lotion and how much of parabens you have on average in your urine. And what I'm showing here is that it was this dose effect. So the more you use, the more you get in your body. So someone that's just lotioning their hands would have less than someone that's lotioning their face and hands, and less than someone that's lotioning their entire body. And then finally, not only is it a specific product, but the number of products. So that goes back to, using 12 products in a day. The more products you use, on average, the more concentration of these chemicals you're going to have in your body. So someone that is just putting on lotion every day is, on average, going to have less than someone that's using 10, 15 products. And as has been mentioned, this is not only important for everyone to consider, but it's particularly important when you're pregnant, because we do know that phthalates, parabens, phenols can pass from the mother to the fetus through the placenta. As Ricky mentioned, it's no longer that perfect barrier. We know it's no longer that perfect barrier. And the fetus is particularly vulnerable. It's this rapid period of development, and we have seen that exposures that happen in the womb can not only have immediate effects, but effects 10, 20, 30 years from now. And in fact, fetal exposure to these chemicals have been associated with many adverse health outcomes that have been talked about, and I've listed some there for you. So it's really important that we study exposure to these chemicals during pregnancy, and we have been able to do that actually in a local population through the Columbia Center for Children's Environmental Health. It's an ongoing cohort, or ongoing study of maternal child pairs from northern Manhattan and the South Bronx. And they were given a questionnaire during pregnancy, during third trimester of pregnancy, about types of personal care products that you use. And then chemicals were also measured in the urine during this time as well. And what I'm just showing you here is a comparison of that local population compared to a national population of women around the same age. And you can see that in general, the levels are higher in the local population compared to the national levels. What's interesting is when we look at parabens, it's kind of the reverse, actually. What we see is lower levels for the local population compared to national. And then when we look at phenols, it's a little bit of a mix. We do see this high level for that DCP that I talked about, the dichlorophenol. And we haven't looked into why we're seeing such high levels yet, but hopefully we'll do that soon. And then just kind of similar to what I talked about earlier with different populations, previously, this research group has looked at types of product used and how much of phthalates are in the urine. And what they found was that there was an association between perfume use and number of products used and the amount of phthalates in the urine. And more recently, this hasn't been published yet, but we've looked at the same types of associations for phenols and parabens. And we see similar findings. So we're seeing that using lotions, perfume, and cosmetics are all associated with high increases in these parabens and phenols. And then back to that idea of the more products you use, regardless of what the product is, we see an association between with increasing parabens. So I'm giving you an example here for methylparaben. So as the number of products you use goes up, the amount of your methylparaben in your urine goes up. So it brings us to the question of how we can protect ourselves without unrealistically just removing the exposure, because we're obviously not going to just stop using personal care products and walk around with never using deodorant or washing our hair. Fortunately, there are some things that you can do, and choosing healthier products does appear to make a difference. This is just an example of the intervention study that where investigators gave 100 adolescent girls these healthier products. So these are products that specifically said on the label, they didn't test the products themselves, but they went off the label. So the label said no phenols, no phthalates, and no parabens. That was the qualifier for how this was going to be a healthier or better replacement product. So it was the same types of products that the girls were using, but in this case it was these healthier ones for 3 days. And what they found was, for the most part, they were successful at reducing the levels of chemicals in the urine. So it goes to show that you can hopefully make a difference by choosing healthier products. And you can do that by reading the labels, but you can also, one resource that I wanted to point out is the Environmental Working Group Skin Deep Cosmetics Database. Just because they've done a lot of the legwork for you, they've reviewed thousands and thousands of personal care products, and they give a summary of how hazardous this chemical is to your health. So you can search right here for your product, and I'm giving an example of just Colgate Total. And you can see up here on the top left, it gives an overall product score in terms of hazard. Colgate Total gets a 4, so a moderate hazard. And one of the reasons it's a little bit higher of a score is because that chemical I mentioned, triclosan, is used in Colgate Total. It's the only toothpaste in the US that's approved to have triclosan in it. So this is actually an easy way to reduce your triclosan exposure. Don't use Colgate Total. So if you look at Colgate Cavity Protection, the score is a lower, it gets a 2. And if you read the ingredient labels, simply, instead of even looking at the website, you can see that Colgate Total has triclosan in it and Colgate regular does not. And then just one more example, looking at lotions. You can see here Jergens gets a score of a 6, in part because of the phthalates and parabens that are in it. And you can see the perfume is or fragrance is labeled as an 8 down at the bottom, so a high hazard, and a paraben is labeled as a 7. And whereas if we look at Kiss My Face body lotion on the right, it gets a score of a 1, so it's the lowest hazard, and it specifically says fragrance free, so you can expect that there's not going to be phthalates in it, hopefully. And on the back it also says paraben free. So not only can you use the website, but if you read the labels, it will give you a good amount of information to help guide you in a healthier direction. And then finally, I just wanted to introduce you to the Silent Spring Institute, just another resource to use. It's a free app that you can download called Detox Me, and they have a lot of really helpful tips on how to reduce exposures, not only to personal care products, chemicals, but around the house, furniture, clothing, food. And they also have some helpful do-it-yourself recipes on making healthier choices, and such as cleaning products, so things that you can make in the house as opposed to buying at the store. And so I just want to end by saying that I know it can seem kind of overwhelming and daunting. I know it does to me, thinking that these are so many chemicals lurking in these products, but I do think you have the power to really make healthier choices for yourself, and it can make a difference. Thanks.
many of the acts that Dr. Spratman referenced are in your booklet. There's a list of about 6 of them. There are many more that exist, but these are just a few examples. Questions?
I'm gonna start over here.
So my question is if a pregnant woman is using these products, can it increase the baby's chance of also having breast cancer?
I think that would be a good question for
I think she just stepped to the bathroom.
Oh, okay. I think she would probably know better than me specifically to do with breast cancer. But
So we'll give you the opportunity to come back. Questions? Yes.
Would hand sanitizers be included in the list of chemicals? We don't think of it, but I
yeah,
guess
so
some sort of hand
there are
sanitizers.
definitely there are some chemicals in hand sanitizers that you probably would want to avoid. Again, it would be good to look at that.
Triclosan is in hand sanitizers many times.
Hand sanitizers have fragrance also.
Right, you can definitely notice that.
And
They're
then
very strong.
hand sanitizers can also like increase how much of like if you have hand sanitizer and then you come into contact, let's say like you hold a receipt that has BPA, the hand sanitizer can actually increase the amount of BPA from the receipt that gets absorbed through your hands. Like if you have hand sanitizer versus if you don't. But it does have, also has fragrance and
Triclosan, yes. Definitely triclosan is in hand sanitizer. Soap, lemon, and water.
Hi, I'm Kiana. This is kind of more of a comment that I thought of during your presentation. One is, my one issue with the Environmental Working Group's website is I feel like they don't take into consideration like safer synthetics, which for me gets into the debate of whether you're looking for purely natural products or, you know, if you don't mind there being synthetics in your products. I feel like they're just ranking for safety, and sometimes I take issues with their ratings. And then just with triclosan and oxybenzone being mentioned in your presentation, I just wanted to like mention too that in addition to all the personal health, you know, hazards of these products, there are like the wider environmental hazards associated, because like triclosan and all these ingredients in soaps, body washes, hair products that are going straight down the drain and directly into our water systems. Things like now we're seeing in areas with like a lot of tourists and swimming, like tropical regions, where the oxybenzone and other chemical ingredients in sunscreens are damaging the reefs and the marine life, and they're banning that. And that so many products are dependent on petroleum byproducts, you know, petroleum jelly, Vaseline, all these things, which is directly, you know, dependent on fossil fuel production and just other chemical byproducts of so many other processes, and then the workers involved in the production of these products. So it's like, you know, the personal health, but it goes out so much further. And I was just thinking about that. So yeah, thank you so much.
So 2 questions. Number 1, are essential oils safer? And number 2, is there a way to remove, once you have these toxins in your body, is there a way to remove some of them?
So I'm not totally sure about essential oils. I would guess it would depend on the type. I know, just from my own experience, particularly during pregnancy, that there are, I think in general, it's not necessarily recommended to use essential oils during pregnancy because they're definitely strong and powerful products. And so I don't know necessarily if they're better or worse, but I probably would depend on the type of oil.
So we're just gonna repeat the question because.
I'm sorry.
No, don't be sorry. We're just gonna have you repeat the question.
I said if a pregnant woman is using these products like in a large amounts, could it affect the baby and give it a higher risk of getting cancer or breast cancer?
So I
I don't know the literature saying that using these products would actually affect the fetus's ability to get breast cancer, per se. However, with that being said, trying to think of like the going over through the uterus and the blood. I would say what is probably more important is the breastfeeding period of time, and maybe not during the fetal period of time, mainly because the mom is able to provide through, they can break the like blood milk barrier, so like what they consume or what they put in their products, sometimes that can get in the breast milk and that can be passed on to the child. And people have looked at the level of chemicals that are in breast milk as a relationship to could it possibly affect the child. Now, these would be very long studies to do. So I don't know of studies that have said like these are the products or this is the level that is in breast milk and this is the association with breast cancer risk. But there is a concern about using some of these products or just the exposures that you have and breastfeeding.
Okay, are we on? We're time. Sorry. You have quite
Hey, Dr. Jasmine, thank you for enlightening us about the risk of product use during pregnancy and for reminding us that we can truly improve our health by actually reading labels and being a little bit more conscious of the consumer product choices that we make. Our next speaker is Dr. Paramita Ore. She has a very long title, and I'm going to go through all. She is the Deputy Director of the Environmental Risk Assessment Unit within the Bureau of Environmental Disease and Injury Prevention at the New York City Department of Health and Mental Hygiene. The title of her talk is A Public Health Approach to Addressing Metals in Cosmetic and Personal Care Products. Dr. Ore.
Thank you again. Glad to be here to speak with everyone here. As Zota mentioned, I'll be giving you a different perspective per se, a public health approach to how in New York City, the New York City Department of Health, we identify consumer products with elevated examples, lead and mercury, and how we address it, and give a couple of examples. So as many of you may be familiar with what is lead. What is lead? It's a metal that's for many years have been used in many types of products because of its many favorable properties. It is durable, it is malleable, but it is also harmful when it gets into the body. So lead can not only cause learning and behavioral problems in children, it can also cause problems during pregnancy, increase risk of miscarriage, have cognitive delays in the fetus, but it can also have harmful effects in non-pregnant adults. It's been associated with adverse health effects, neurological problems, kidney problems, as well as reproductive problems in adults, both male and female, including problems like impotence or infertility in both men and women. So in New York City, by law, there are certain at-risk groups that are routinely monitored for blood lead levels. So before I even go into that, how does lead enter the body? In general, lead is, the skin is a fairly good barrier for lead, but lead can enter the body through the GI tract, through the mouth, via either direct ingestion or eating products that contain high levels of lead, or hand-to-mouth exposure, which is essentially touching surfaces that may have high levels of lead and then putting it in the mouth. You may have heard of lead and lead paint hazards in young children that live in old homes with, say, damaged paint or peeling deteriorated paint where there may be lead dust in the surfaces. Young children that tend to crawl around a lot, they also put their hand in their mouth and everything else in their mouth a lot. They can get exposed to that lead dust through that avenue. But in another way of basically getting exposed to lead is by eating certain foods or spices or supplements, and I'll kind of touch upon that as well. So by law in New York City, certain groups are routinely tested, as I mentioned. Doctors are supposed to give a blood lead test to children at ages 1 and 2 years of age, and also up to age 6, they are supposed to assess the child for risk of lead exposure and test the child if he is at risk. Also, people that work with or around lead, workers, say bridge workers, their employers are supposed to give them a routine blood lead test to monitor exposure. Pregnant women, by law, are supposed to be assessed by their provider during their first prenatal visit to determine if they are at risk and given a blood lead test if the doctor feels that the woman may be at risk. And we at the health department, we receive all these blood lead results and we follow up with individuals with elevated blood lead levels. And part of that follow-up, you're asking questions about what sort of products they use and variety of products, foods and spices, medicines, jewelry, etc. What our data shows, and we've been doing this for many years, over 10 years, primarily one of the most common sources of lead poisoning, especially in New York City children, is lead paint hazards, but it's not always the case. Also amongst adults, amongst workers, occupational hazards are the primary source, but again, not always the case. It's use of consumer products found to contain high levels of lead. So it's a very busy slide, but over the years we've seen a variety of many different types of consumer products, and not just cosmetic or personal care products, but a span of different types. But in general, what we routinely keep seeing are certain types of supplements, referred to as certain Ayurvedic supplements or Rasa Shastra Ayurvedic supplements from India, found to have high levels of lead. But also certain other types of remedies. We've come across a West African remedy called calabash chalk, a Dominican remedy called litanfidio. Some of you may be familiar with some of these terms, but they may have lead, and they often do not list it on the product ingredient. We've also seen a variety of spices, primarily some hand-carried spices that we continue to see very high likely to have high levels of lead. Certain spices from South Asian countries, India, Bangladesh, Pakistan, also the country of Georgia. Again, the ones that are hand-carried, that people are bringing from abroad, more likely to have these high levels. Cosmetics, religious powders, cultural powders, certain South Asian, Middle Eastern products called fahol, gajol, surma. It may be used as cosmetics, sometimes used to ward off evil eye. Surma is essentially ground up lead galena, but it is commonly used in many parts of the world, or particularly in the South Asian, Middle Eastern world, for a variety of reasons. Firu from Nigeria, there's literature that we haven't seen cases in New York City, but there is literature that very high levels of lead, essentially that too is ground up lead. Religious powders, sindoor, also we've seen associated with lead poisoning cases. We've had lead poisoning cases in children around use of amulets and babis or certain charms found to have high levels of lead, even some jewelry. When the child mouths the jewelry, and they do mouth a lot of it, they can get the lead into their body that way. And then finally, some types of ceramic ware, especially sort of the round Mexican ceramic ware or ceramic ware painted with bright colors. It's the lead maybe in the glazing, and so when people cook food in the ceramic ware or store food in the ceramic ware, the lead can get into the food when they use it this way. So what is our approach? Well, first is to identify a potentially hazardous product that has high levels of lead. We're able to do this because through these blood lead levels that we are continuously receiving, right? Annually, we receive over 400,000 blood lead reports for children and almost 100,000 for adults. So, and we follow up in all the elevated cases. So we are able to identify a potentially contaminated product through that. And once we do so, we actually go sort of undercover shopping in New York City stores, looking for the product itself or the similar type of product, maybe similar indications, similar manufacturer, collect samples, we test these products for lead. And then if a store is found to be selling a product found to contain high levels of lead, we have the authority to take enforcement action, and we do take enforcement actions to stop the businesses from selling these products. We also notify our federal partners. We've worked with the US FDA and other organizations because we have jurisdictions in New York City, but we want to reach further because the source is often not limited to just New York City. Also public awareness activities, talking to you guys here, education, because what our data also shows is that many times people are hand carrying these products from abroad and they may not be available in New York City stores. We have a lot of information around lead poisoning prevention on our website, nyc.gov/lead. Please do check it out. Of course, as far as lead in products, it's typically not listed as an ingredient, so if one suspects that they may be using a certain type of product or they may be exposed to lead, what we recommend is speaking with their doctor and asking for a blood lead test. And giving an example, say around mercury, some of our work around mercury, also a harmful metal. Now, mercury is not routinely monitored in New York City, but we may learn of hazardous consumer products containing mercury we have learned through population surveys. So mercury, in a nutshell, it can come in 3 forms. Primarily, one of the forms is organic or methyl mercury. It is easily absorbed through the GI, main target organ, central nervous system, or kidney. One of the main ways people can come into contact or get exposed to mercury, methyl mercury, is through fish. We do have some documents out there for picking safe, making safe fish choices. Inorganic mercury, mercury salts, may be found in consumer products like skin lightening cream and certain supplements. And metallic mercury, something that you may associate with mercury, may be found in old thermometer. Just jumping into some of the skin lightening cream and mercury, we learned of this being a potential issue in New York City early in the 2000s during a representative population survey that was conducted during that early 2000. Almost 2,000 adults in New York City were randomly selected, and urine and blood samples were collected from them and measured for various contaminants. And during that time, we found a small group had extremely high levels of mercury in their urine. And staff investigation followed, and what was found was that there may have been a skin cream association with these high levels. And we were able to get a sample of one of the skin cream products, tested it, mercury levels over 6,000 parts per million. To give a frame of reference, there is a regulatory limit federally of how much mercury is allowed in skin lightening cream-like products or cosmetics, and that's 1. So this was extremely high. This triggered a Department of Health basically survey of New York City stores looking for these types of products, not just the particular product, but others as well. And products were found. We issued commissioner's orders to remove the products from store shelves, to press events. We wanted to raise awareness amongst many of these products at the time identified were from Dominican Republic. We worked with Pan American Health Organization to raise awareness in the Dominican Republic. So basically, we want to enforce and affect change as well. This is just a publication pointing to that. The list of products that were identified during that time was published. Dr. McKelvey, and you can Google it, it will pop up. This is a warning sign during the commissioner's orders. They were posted on all the stores in an effort to raise awareness amongst potential users of these skin lightening creams. In a nutshell, do not use skin lightening creams that list mercury as an ingredient or no ingredients are listed. And mercury may not always be listed, so speaking with providers if users are using non-prescription skin lightening creams or medicated soaps or skin skincare. So since that time, we continue to survey New York City stores in different neighborhoods, because we know it may be skin lightening creams may also be used in other cultures. Again, we mentioned South Asian world. We recently, during a survey, identified about 10 products, 8 of them from Pakistan, skin lightening creams, and 2 medicated soaps from Spain. These products were removed from store shelves. We worked with FDA again. They put in place an import alert, which essentially is they'll stop them at the borders. So it's a multi-pronged approach. It's identifying a potential hazard, investigating, enforcing when we can, and also educating. And there are a lot of resources. Please do check it out. And thank you for your time.
Questions?
Thank you. That was terrific and informative. New York is doing a lot to manage the consumption of metals, lead, and mercury. Apparently the FDA is not doing its job in terms of our consumption of other hazardous ingredients. What can New York City do or not do in that regard in terms of managing our consumption of the ingredients, phthalates, and parabens that we've learned about today?
I mean, some of those I think I will direct it to co-speakers, but as far as metals go, we do continuously, FDA has, sometimes it's almost like we notify them and then they follow up. So we are continuously notifying FDA of our findings around products that we may find with elevated, I can speak for the metals aspect, and they have taken action, such as for the skin lightening cream, they have issued an import alert on many of these products so that when businesses are trying to bring these products through the borders or customs and borders, they are stopped and screened. So we try to work closely with FDA. There may be gaps, but it's a continued effort.
But New York City doesn't have a domain over these other ingredients?
Well, I can speak for some of the work that I'm familiar with, but others, if you want to talk anything about parabens and phthalates that you mentioned.
I would just say, so I mean, I think I guess there's a couple of things. So there have been efforts in the federal government to introduce legislation that would update the main federal law that governs the health and safety of personal care products, but it was introduced as a bipartisan bill, but it hasn't really gotten much traction. So there are some senators and other government officials that are cognizant of this issue. But I guess in the meantime, the other approaches that people who are concerned about these issues are taking, one, at the state level in New York and California, there have been more right-to-know pushes for information, particularly in the occupational environment. So for professional, like products used in professional hair salons and around cleaning products, so that particularly workers have more access to the information in the products. And then the other thing is NGOs have really been pushing the marketplace to clean up their supply chain. So targeting Walmart and Target and CVS, and a lot of them have made commitments to make all the products that they're selling free of phthalates and parabens and a kind of a priority list of chemicals in the next, let's say, 3 to 5 years. So there seems to be right now, to also kind of get the private sector more engaged.
So stay tuned. That'll be part of what I talk about.
Hi, just a quick question. So you mentioned a lot of imported foreign products with really high levels of lead and mercury because of probably even less regulation in other places. But I'm curious, I know a few years ago there was a bunch of studies about lead in lipsticks and name US brands. And I'm assuming these levels are much lower than, some of the other products you were mentioning, and the concern is more the cumulative ingestion over long-term use. But I'm just curious if you're familiar with any of those studies about lead in lipsticks, or just more US-based products?
Avon products that were under scrutiny.
Avon products.
So the Food and Drug Administration also oversees that aspect, and they monitor these products, and they have limits for these products. And our follow-up usually on those lead-poisoned individuals, we have not really identified, say, a lipstick as a source. But yes, I do know that the FDA monitors these and looks for levels in these products, such as lipstick.
Yes, hello. I was wondering, you mentioned about like importation, being imported spices and different things from different countries. I was thinking about hair product, Indian hemp. You hear about sage, different things, and maybe jojoba, or I might be saying it wrong. Sulfur, tar. I just wanted to know like your perception and your intake on that. Those products.
So the word imported can be, a lot of the products.
I'm sorry, Dr. Parmita, can you go back to the microphone at all, or just pull it out to the side for you? Yeah, there you go.
So the word imported can be sometimes alarming because many of our products are imported. But the types of products that we have found that I was referring to, especially, for instance, certain spices. Now, say our South Asian shops where we have a lot of the spices that are imported, and we collect samples of these all the time. We're not finding these high levels of lead in those products. What we are finding are in the hand-carried products, and that may be because of the lack of regulation elsewhere, or the grinding of that spice in the abroad country in an old machinery, or addition of color pigments to make the spice brighter, or addition of weight. So as far as the spice world goes, it's not the term imported, which essentially means brought from abroad, but these hand-carried. You mentioned some hair product.
Yeah, Indian
hemp,
and it would have
the
like,
henna?
Yeah. No, not henna. It's called Indian hemp, and it
Indian
would have
hemp.
like
Oh,
hemp in there and the hair products. It's like a balm.
We've not really tested that. We've not had any cases associated with that, so I can't really speak to that, or as far as the metal contamination. But we have tested henna and found really low, trace levels, if not detect. So.
Any other questions? Okay. All right. Thank you.
All right, thank you, Dr. Hore. That was I learned something new. I used to use a product called Surma growing up, and now I know that I used to just put powdered lead in my eye. Okay, so we're gonna do about 15 to 20 minutes of Q&A. We're gonna just cut it a little bit short because we are behind on time. So I would like to invite our 3 other guest speakers up to the stage. And you all can ask questions by raising your hands. Cecil, Stephen, and Corrine will be rotating a mic, as well as note cards. So if any of you, feel like you want to flesh out your questions in written form or don't feel comfortable speaking, you just raise your hand, get a note card from them and a pencil, jot down your question, and then hand it back to those same people. Stephen is right up here. You all know Cecil, and then Corrine is in the back in dark blue. Alrighty. Yes.
This question is, any of you can answer, but Dr. Soprano, you were referring later to filing. Now, I have cologne, and I'm not willing to throw out this. I'm sure some women here have perfume that is also not willing to throw out. Can I throw it on my clothes instead of my skin, so I'm not applying it directly to the ectoderm? Is that a good idea? Does it reduce my chances of getting phallic?
I haven't seen that talked about a lot, but I think that definitely is a great option. Cutting down on the direct contact.
Other questions? Yes.
I'm wondering about occupational health, particularly for the workers at beauty salons that are constantly exposed to these chemicals. So any research about common occupational conditions that are seen amongst these workers?
I would just say, I think this is an under-researched area. I know some people who are especially working on kind of nail salon workers, and they have documented some of the dimensions of those conditions. And there have been some studies done, I think these need to be confirmed, showing how, people who work in hair salons and kind of in the cosmetics industry are at higher risk of certain adverse pregnancy outcomes. I know of at least one study that did that in California, but I think that there are some people who are beginning to work in that space, but in general, we just really don't have enough data.
Any other questions? Anyone else? Yes, ma'am. You haven't spoken,
Okay, a quick flashback. I just followed him. If he puts the cologne in his shirt, then I'll inhale it. So that doesn't seem like a cologne. But my question is, on the federal level, do you see any of the current administration's pushbacks on environmental protections that are also will have an effect on the kinds of research and the allocation of money? Selection of study samples, etc., that you could give us more horror news, because we don't have enough yet.
I'll just say, maybe Cecil's going to talk about this, but so FDA doesn't do their own health and safety assessments of chemicals used in personal care products, and they actually rely on the EPA's health and safety assessments of many of these chemicals used in consumer products, which is under the jurisdiction of TSCA. And the implementation of the new TSCA law has been dramatically affected by the new administration. Because as many of you probably know, the EPA has just taken a big hit under the new administration. So it is affecting how we evaluate the health and safety of chemicals and the methodology we're using. So even though they're supposed to use the best available science, they are not. That's what I think.
I'll just very quickly add that TSCA, which in your booklet you can see there some terms there for you. TSCA stands for the Toxic Substances Control Act. It is the federal law that governs the use of many chemicals in our society. The administration, the current administration, that person who shall remain unnamed, I don't call that name, has essentially put not only, they haven't only just rolled back how much money they've allocated to the EPA for doing this kind of work, they haven't only tried to curtail the new law from actually doing what it is supposed to do in terms of testing and regulating chemicals for safety determinations, but they've also put people in particular positions that have come directly from industry for whom these products, they're no longer obviously working for the industry, but the industries that they formerly worked for, that's their bread and butter. And so they're essentially doing everything to slow walk, stall, slow down, all of the parts of the law that essentially are now in place to help sort of get the information that we need about the toxics in the chemicals in our products. Any other questions? Yes, sorry.
Hi, good evening. Thank you all for sharing. I have a question about hemp oil and seed and then CBD oils. Have you heard of any research of the long-term effects of those products?
I would say I have not. That's something that I would probably look into, but I have not.
I think there's a lot of reasons to look into it, but I'm not familiar with that.
There's now quite a bit of, there's now there's actually been some freeing up of research dollars towards studying CBD, which is for other people, this is the cannabis, essentially cannabis and sort of medical uses of cannabis. The federal government actually just sort of allowed some research to go forward, and so that's underway at this point for multiple kinds of medical uses of cannabis, so we'll have to wait to see what happens there. We have questions?
Yes, a couple of people asked this question actually. Besides decreasing our use of toxic products, is there a way or ways to actively detox the chemicals from our products, the ones that are already in our system?
I would just say that at least some of the chemicals we've talked about today are non-persistent, and that means they don't stay in the body for very long. So some of the other chemicals that maybe you've heard about, like PCBs, which were banned in the 1970s, but they're still being found in people's bodies because they stick around a really, really long time in the environment, like decades, or these perfluorinated chemicals that are in the news because they, there's contaminated drinking water sources across the country. These also, they're very hard to degrade in the environment, but at least some of the chemicals that we're talking about, like the metals and the phthalates and the parabens, those don't have as long of a half-life. So the good news is that, if you did discontinue the use of certain products, you could eliminate it from your body. So I don't think we know of any vitamins or anything you could take that we know that would cleanse your body completely. That I don't think we know.
I agree, and I do want to say that sometimes we get questions from doctors that are wanting to chelate the lead from the blood, but we again say and one of the reasons the health department follows up with the individuals with elevated blood levels is we want to figure out what the source is and eliminate it whenever possible, and then the body excretes.
Great. Another question. In terms of chemical burns, if there's tingling, burning, numbness, and heaviness on the scalp where burned, if that's done so for many years, what could that mean? What's the impact?
I think that, for one, the long-term impact means that you've had a higher dose of the particular product that's been placed on your scalp. Now, if that one exposure is going to lead to uterine fibroids or endometrial cancer and things like that, it's unclear. We do not know that literature, but I will also say that that's just one exposure, and one has to also look at the collective exposure that they have when they're using hair care products. So yes, that is an extreme dose, but one shouldn't then think that that extreme dose will be the cause of a hormonal health issue.
Okay, this is kind of the million-dollar question. What do we do when alternative toxic-free products are expensive? How do we make sure that as we transition into a toxic-free market, we are not leaving people of color in low-income comforts behind?
Yeah, I think about that a lot, and some of the things that I've turned to personally to just figure out how to offset some of these costs when it comes to these products is a DIY. So if there are certain products that I know that I use on a routine basis, like this is my bread and butter, I have to use it all the time, I'm going to be highly exposed to it because I'm using it so much. Like, I don't wash my hair every day, I personally do not, but I'm going to use like a conditioner pretty much on a daily basis. Then what I've done is say, okay, either A, I'm going to splurge on an organic product for that particular item because I know I'm going to be highly exposed, or B, I'm going to look at YouTube and find a DIY. So I've made flaxseed gel, like we actually boil flaxseed for my hair, for moisture. People have talked about using henna in order to like hide the gray. So I've actually prioritized like what I will make myself and what I will spend the money on because I know my exposure is high.
I mean, I think there's also long-term, you know, a role for grassroots campaigns that hold, you know, companies that make products, you know, at the lower income spectrum to, you know, also be held accountable for the health and safety of these products. So, I mean, I think that's a longer term vision, but something that we should also keep in mind.
I just want to say thanks, all of you, for the very informative presentations. I've been, so my discipline is in sociology. I'm a graduate student, and I've been doing some research on skin lightening products and focusing on the regulation of hydroquinone. I don't know if any of you have been following that and what the status is, which, I mean, hydroquinone is the next most popular skin lightening agent next to mercury. And if you go to Walmart, you can see products, or any, you know, beauty store, you can see products with that chemical in there. And I don't know if any of you, I mean, the FDA has done some recent rulemaking within the past 10 years, but hasn't, to my knowledge, acted definitively in terms of removing it from over-the-counter access. So I don't know if any of you have any comments about that.
Agree, it is a common ingredient active ingredient we've seen in these skin lightening creams when we're doing surveys for mercury. But unfortunately, that's your update is, at least my knowledge, it is being evaluated, but still does need to be sold at certain concentrations.
All right, unfortunately, the good folks who work here at the Schomburg need to go home. We are pushing up against boundaries of our time. So I'm supposed to close up again. My name is Cecil Coleman-Mark. I'm the Deputy Director of REACT. I want to make sure and do a couple of things right at the outset and say a lot of what you've heard this evening is incredibly helpful and important information. I can't stress enough the request that you heard earlier to take this booklet, pass it on. If you want another one, we have some extras. Teach people some of the stuff that you've learned here today. Share it with your neighbors, share it with your loved ones, share it with your family. The second thing I want to say is, if you are a member of WeAct, put your hand up. Okay, excellent. So those of you who are WeAct members, turn to the person who didn't put their hand up and let them know how important it is to become a member of WeAct. We are a membership organization. We are 700 plus members. The vast majority of our members live in Northern Manhattan, but we don't turn away anyone. If you came from Brooklyn, if you came from the Bronx, you know, and you needed a visa to cross the Brooklyn Bridge or something, we'll accept you. It's okay. There's no wall here around WeAct. We believe in building knowledge for our members. We believe that knowledge needs to translate into working with legislators in our city, in our state, and at the federal level to make policies that are more protective for our communities. So we ask you to join us. We have a $25 membership. It is really a cheap deal, and if you need a layaway plan, we got that too. So, thank you so much. Yes, ma'am.
What if there's youth who are interested in being members? Is there some type of discounted rate for that?
You come talk to us. We'll find a way to make sure it happens. Just talk to us.
Okay, thank you.
The other thing I want to say is, you heard me talk about building power, and that is really important. The industries that peddle these products in our communities have a special place in hell, I am sure. And the reason I say that is because most of what happens in what goes into these products is no accident. Chemicals are added to products intentionally. Labels disclose what they want to disclose. Some requirements exist for them to talk about active versus inactive ingredients. but they don't disclose everything. Why? Because they say, that's part of our secret sauce. And if we tell everyone, then they will be able to make our products and they won't be able to make the money that they make. That's the real bottom line. You heard Peggy talk about the fact that African American women use these things 9 times more than their counterparts. Latino women use these products more. And we're not just talking about, you heard the range of products that we talked about today. We talked about beauty care products, we talked about cleaning products. These companies can put products out onto the marketplace without testing them. Without testing them. What does that mean? That means that each of us are the guinea pigs. I so want to thank Dr. McDonald for really raising up. Oh, and this is not just about women. This is about our brothers too, our young men. They too are going into the barbershops. And I'm telling you, let me tell you what happens to me when I go to my barbershop. My barber pushes my chair back and he begins to put like things on my face, and I'm like, I stopped him. I said, you cannot, we're gonna have a talk, right? You can't put anything on my face without me knowing what's in it. And I helped him get some new products. So when you take your sons and your nephews and your cousins and your brothers to the barbershop, one time, do that with them. And introduce them to the fact that they too are being exposed intentionally. This skin lightening cream thing, is the thing that gets under my gut the worst. Because what it says is that none of us who have lots of melanin are good enough. And there's no way we should be accepting that. And worst of all, there's no way we should be paying to take it. Now, I want to thank Assemblywoman Carmen de la Rosa for being here. I want to acknowledge that she has agreed. We put out our state policy agenda for the state legislative elected officials that represent Northern Manhattan on Saturday. And she agreed to take up one of our bills, which is a bill to deal with mercury in skin lightening products. And we want to thank her, want to acknowledge her as a sister. She told her story on Saturday about, she's like, I'm not putting any more products in straightening my hair, right? And she's like, you see the full natural right there. And so we're deeply grateful for that support. The other person who was at our meeting on Saturday is State Senator Robert Jackson. He also said that he was going to sponsor a bill in the Senate. But you know what they need? They need to hear our voices in our communities. That's another way that we can deal with these issues of chemicals in our products, in our marketplace, where the companies feel they can do whatever they want to our communities and profit off of it. That has to stop in 2019, and we need you all to be a part of it. The last thing I'll say is another way for people to get involved is that there are lots of marketing campaigns, and when we say market-based campaigns, what we're talking about is organizing people like yourselves into campaigns to say to the corporations that are producing the toxic chemicals in these products that we use every day, that you can no longer use our bodies as guinea pigs. Think about what you heard today. You heard that, Dr. Diana Hernandez talked about the 12 products that she used. I won't tell you how many I use, right? But think about the fact that we're putting these things on our skin, we're putting them on our scalps, where there's lots of blood vessels up in your head, right? This is where our brain is, right? One of the most important organs in our body, and we're literally applying toxic chemicals directly to that, yeah? And so we want to ask you to join some of the market-based campaigns. We are working with folks to get phthalates out of food. How many of you knew that phthalates was in mac and cheese? Show of hands. Mac and cheese, phthalates, people who know about mac and cheese, tell your partners, your friends, your neighbors sit next to you about that as you go out the door. But come to the We Act website, www.weact.org, get more information. Become a member of We Act, please. And if you don't become a member of We Act, that's okay. But we really hope you do, because it's not that much, and we got legs. But we also encourage you to join organizations and to join some of these campaigns. We need to target more of the product manufacturers that, say to people who are Black, brown, folks from the South Asian communities, etc., that it's okay for you to poison yourselves. It's okay for you to poison yourselves and pay for it. That's got to stop in 2019. And so we can certainly share more information with you about the many campaigns that are going on to get toxic chemicals out of particular products. I'll close by just saying an incredible thank you to all of the presenters. If you are interested in those presentations, please give them a hand. If you are interested in the presentations, we're going to post the presentations on our website. And so you can go to www.weact, and after you become a member, then you can, no, I'm just joking. You can get the information about the presentations. We have membership meetings on the second Saturday of every month, except August and December. We'd love to see you. That starts at 10 o'clock. And Peggy's going to remind me something after that. So we have campaigns around Mind the Store and 99 cents campaigns, but you can get a lot of that information also on our website. There's a lot of dollar stores in our community, and people think of dollar stores as sort of these small operations, but they are multi-billion-dollar operations. The 99 cents and dollar store operation operates east of the Mississippi and west of the Mississippi. And they have massive chains of production products movements. They're just in some instances as big, almost as big as like Walmart and Amazon. Not quite, but they're very close. So don't even think that those are just like your little 99 cents neighborhood stores. We've actually gone into those stores, and with the help of some of our partners, we've tested products. The new Attorney General that's coming in, we have transmitted a lot of this information to her, and we're asking her to continue to be a watchdog. So you need to call their offices and make sure that they know that you're watching them as well, right? Because we do pay all of these people's salaries, and they do work for us, and we should make sure that they are advancing health and protection in our communities. Now, we are really over time, and so I want to thank again the presenters. They've done a nice round of applause, making sure you're welcome. I want to thank all of the UX staff, especially Lubna Ahmed, our environmental health director, who was tremendously hard to pull this together. Thank you so much. Milagros Leos, Milagros is one of our presenters. We have in the background Chris Dobbins, our communications person, and Carlos Ucino, who's also over here. He's our tech guy. And he makes sure that we were able to live stream effectively. So this presentation and this workshop worked to reach out to a number of different people. I want to thank Evelyn Joseph and all the other staff who volunteered to get everything together for us. Really amazing. Thank our co-partners in this process, Dr. Diana Hernandez for the Children's Center, and Dr. Ricky the P30 Center, the P30 Environmental Center, sorry, and Dr. Ricky Pereira for the Children's Environmental Health Center. Gail Garbowski from, where's Gail? Yes, thank you, Gail. And all of the interns and other volunteers who helped us. Most of all, thank you. Stay in touch with us, please, please, please. Become members.